All right, we're on.
All right, hi everyone. I'm State Senator Jason Lewis, and thank you very much for joining us for this Facebook Town Hall Live. And I'm joined today by Tom Dalton, who's our Communications Director, and I want to thank Tom for all of the work he's been doing, really going overtime the last week or two with everything that's been happening on the communications front. So thank you. I'll share some opening comments with you, and then answer questions and welcome your comments, feedback, and ideas as well. So, as you probably know, please type your questions into the comments in Facebook, and we will make sure to get to as many of your questions as we can. If there's anything that we are not able to answer right now during the town hall, we'll be sure to research the issue and then get the answer to you afterwards. We'll just add it in, I think, Tom, into the comments for the Facebook Live event. Let me start out by saying that I hope that you and your loved ones are safe and well. We are facing an unprecedented crisis along with the rest of our state, our country, and indeed the entire world. This is no doubt an uncertain, confusing, and challenging time for all of us. Many of our neighbors, our small businesses, our nonprofits, our municipalities, and other institutions are facing very significant disruptions and hardship. At the same time, this crisis is bringing out the best in ourselves and our communities. Many people and organizations are reaching out to help those in need. Thank you. We are so grateful for the outpouring of support that we've seen to those of our neighbors in need. I want to especially thank our medical personnel, our first responders, and others who are on the front lines of fighting this pandemic, in many cases putting their own health and safety at risk for others. Our government agencies at the local, state, and federal levels are all working together with a two-pronged strategy. The first part of our strategy is to respond as aggressively as possible to contain the spread of this virus and to treat those people who become ill and need to be hospitalized. This is all about saving lives. That is the most important goal that we have right now. And we all have a part to play through social distancing or physical distancing and following the guidance of public health authorities. Second part of our strategy is to respond as aggressively as possible to contain the economic impact of this pandemic and to provide as much support as quickly as possible to workers, to businesses, particularly small businesses, municipalities, and others whose livelihood has been disrupted by this pandemic and the response to it. Our government has been taking action. The federal government has mobilized, set aside partisan differences, which has been really good to see, and they've already passed legislation to provide emergency funding for public health, for the Medicaid program, upon which over 1 million residents in Massachusetts rely for their health care, paid sick leave, paid family leave in certain circumstances, and funding to shore up the unemployment insurance system. As you probably have heard, Congress is also working with the Trump administration on a very sizable stimulus package, could be as much as $1 trillion, that hopefully will provide immediate relief to workers and businesses and really help to mitigate the significant economic damage being caused to our communities and our economy from this pandemic. Similarly, at the state level, the state legislature and Governor Baker have been working very closely together. We have already passed emergency legislation to provide additional funding for our state and local public health departments, and that money is on its way out the door, and also to enable quicker access to unemployment benefits for those who may be laid off, furloughed, or otherwise lose their jobs during this crisis. The state has also created a $10 million loan fund for small businesses and nonprofits to provide working capital to help them weather the storm, and has already acted to push back sales tax and meals tax payments that would otherwise be due this month to also help small businesses, especially restaurants, to get by. We are working hard, I can assure you, in state government, and certainly I know in our local governments, to respond to all the challenges that are arising, and we will provide whatever assistance we can going forward. Many, many different actions to help workers, families, seniors, businesses, schools, municipalities, nonprofits, and others are being actively considered. So even if I can't tell you today exactly what action we will take, I can assure you that all these steps are being actively considered. Before we go to questions, let me address a few specific issues that I know many people are concerned about, and we have heard from many of you already over the last few days. First is access to testing. We know that unfortunately we were not well prepared when this outbreak began, and did not have enough tests available. The capacity, however, has been ramping up very quickly over the last week, and is expected to continue to ramp up quickly moving into next week. Our state public health lab, which up till now had been doing all the testing in Massachusetts, has doubled its capacity, and we now have brought online a number of private labs as well that are also able to do tests. So while right now we still are facing a backlog in getting tests done and in getting the results back quickly, we do expect that in the coming days that should improve, and more people should be able to get tests as they are needed. Again, there are certain criteria in place for who should be getting tests, but we should be able to speed this up and hopefully also get results back faster. But we do certainly recognize that continues to be a major concern. Second is the issue of personal protective equipment. Obviously, this is vital to protect our healthcare workers, our first responders, and others who are on the front lines of fighting this virus, that they are protected as well. And we know there have been severe shortages of personal protective equipment, whether that's masks, goggles, gloves, gowns, and other equipment. This has been escalated through the state's command structure for dealing with this outbreak. We have activated our emergency management system, which is known as MEMA, and we are doing everything we can to source additional personal protective equipment in our state and around the country. I know the federal government is taking emergency action too to increase production of personal protective equipment. So we recognize there are shortages right now. It is a big concern for I know for our healthcare workers and first responders, and we are trying to work as quickly as possible to increase the supply of personal protective equipment and to get it out to those who need it. Third issue I wanted to address is the supply chain. The supply chain for making sure that our grocery stores, continue to be stocked, our pharmacies, cleaning supplies, and other essential products, that we all depend on for our daily lives. I know we've probably all been to the supermarket, recently and seen, empty shelves in some cases, and that is frustrating and a little scary. But I want you to know that ensuring that our supply lines are strong is a very high priority for government. I know this is from, all the way from the federal government down through state government, and we are working closely with the private sector and trying to make sure we take all actions so that our supply chains, again for food, other essentials, remain strong. And no matter what happens, we can keep our grocery stores stocked, our pharmacies stocked, and other essentials that we all rely upon. Last issue I wanted to address right up front, and then of course we will get to whatever other questions and issues you want to raise, is, people are obviously asking, how long will this likely to go on, and what additional steps for social distancing, might still be required. And here I have to be honest with you, nobody really can answer the question of how long this will go on. We can certainly look at the experience in China and now in Europe to give us some idea, but nobody really knows. We certainly expect, this is something we're going to be dealing with for, for at least the next 4 to 8 weeks minimum. But we don't know how much longer than that before the worst of the pandemic is behind us. And in terms of social distancing measures, again, we are following the guidance from public health authorities. The reaction and the measures that have been taken in terms of closing schools, daycare facilities, only allowing takeout and delivery from restaurants, these are all taken because we are following the advice of public health authorities, state public health authorities and federal public health authorities, and our local boards of health as well. So we will continue to follow their guidance. I can tell you there are no plans right now at the state level to go to further restrictions like a shelter in place. There are no plans right now to do that. But again, we are following, the governor, of course, has the lead here and is following closely what is happening with the outbreak and what advice we continue to get from public health authorities in terms of additional steps that may be taken at the state level. Last week, the state Senate created an emergency task force, and I am a member of that task force. And we are, the role of that task force is to coordinate very closely with our colleagues in the House of Representatives and in the Baker administration. So we are very rapidly understanding what all the impacts are of this pandemic and working together to figure out what actions can be taken, legislative action, budgetary action, executive orders, and other steps we need to take to both contain the virus, make sure our healthcare system is functioning optimally, and contain the economic damage as well. The State House right now is closed to the public, but I want to assure you that my office remains open for business, and I really want to thank my staff who are working incredibly hard through this crisis and doing everything they can to be responsive to you, our constituents, and our local communities, to answer your questions, to work to resolve issues that are arising, and to continue to do our work on the state budget and legislation and other important projects that we are working with you on. You should certainly email us, call us, or use social media to reach us, and we will get back to you as soon as possible to answer any inquiries you have. Finally, let me emphasize the importance of relying only upon trusted sources of information. Your local town or city websites and your local Board of Health is an excellent trusted source of information. The state website at mass.gov/COVID-19, mass.gov/COVID-19 is an excellent resource. And I urge you to check it out. And of course, the CDC, Centers for Disease Control, is another excellent source for health information. Please rely upon these sources and be very wary of information and rumors that you may see on social media. Okay, now let's get to your questions, comments, and feedback. Tom.
So we've got tons of great questions already. And there are really lots of excellent questions from a lot of different subject areas coming in, so we should get right into them. Sherry Vandenacker asked, school districts seem to be struggling with how to keep kids engaged without creating inequities by giving new instruction. Is the Department of Education working on guidance for districts, especially if shutdowns last longer than April 7th? Also, would you consider creating an education resiliency task force for times of future national or local crisis? We in higher ed could be resources.
Great. Thank you, Sherry, for that question, and thank you for your service also on the school committee in Reading. So the answer is yes. The Department of Education, DESE, is looking at a variety of ways they can support districts while schools are closed to improve the quality of teaching and learning that can go on. So for example, they just announced a partnership with WGBH, the public television station, who will be broadcasting educational programming, special educational programming for students, and that will be particularly helpful for students and families who may not have the same access to the internet and technology as other students. One of the things we are particularly concerned about is disparities in access to learning during these shutdowns. So there have been efforts, and I really applaud local school districts for leading the way here to make sure that students do have Chromebooks or other technology. And there have also been efforts on the part of our internet ISPs, our carriers, and I thank them to make sure internet access is available, expanding hotspots and broadband access. So I think there really is an effort underway to make sure that every student can continue to learn. Now, there are big differences across schools and districts, and I think even across what different teachers are doing. And that is certainly a concern for us, but I think under the circumstances, folks are doing the best they can, and hopefully that's going to continue to improve day by day. I think your idea of a task force, to learn from this and to improve the resiliency of our school districts, and also to make us much more prepared to do remote learning and distance learning, because even without this pandemic, that's going to become increasingly a part of how we deliver education. And I think particularly high school and higher ed. So I was literally just having this conversation with my wife earlier today, who's a teacher in middle school, and we were, trying to be optimistic and look for, the silver linings with this crisis. And I hope this is one of them, that we will learn a lot about how to improve our delivery of remote learning and distance learning and new creative strategies for doing this. Once this pandemic is behind us. So thank you.
Thanks, Senator. David Coughlin says, insurers are denying claims for business interruption, saying they only cover this in the event of a physical casualty. It would be huge for small businesses if they could get these claims covered. Is there anything the state can do?
Yes, again, thank you for that question as well. We are definitely hearing about this issue. I've heard from a number of businesses in my district, and so we are talking to the Division of Insurance about what we could do here, and whether insurers are going to be covering losses, or whether we're going to have to take any legislative action to try to provide additional assistance. But I don't have a better answer for you yet in terms of what action we might be taking in this area. But certainly wanting to assure you we're well aware of the issue and the concern.
Persede Kalabi says, thank you for sitting apart and showing some social distancing. Most politicians in televised news conferences are standing as close together as in normal times. And I will say, we did have the conversation before we started. Is this really far enough?
We'll move a little further.
We've got some more questions here. Let's see. Kaylee Mills Stockberger asks, any plans to close non-essential businesses?
So the actions that have been taken so far, most of them by executive order by Governor Baker, are obviously to close schools, and that's a statewide order now for all K through 12 public and private schools. Also to limit restaurants and bars, only to takeout or delivery. There was also further order yesterday announcing that childcare providers, daycare providers will also have to close by the end of the week, although there will be emergency childcare facilities that will be licensed to provide care for the children of essential workers like healthcare personnel, first responders. So those are all in place or will soon be in place. Many of our businesses already are having their workers work from home remotely whenever it is possible to do so. Obviously, some businesses it's not possible to do so. There aren't any plans that I'm aware of as of right now to shutter more businesses, or to require people to essentially shelter in place, other than going out to get food and medicine and so on. So those plans are not currently, there's no plan to do that right now. I know, people are looking at what's happened in Italy and Spain and, some parts of the United States. And again, as I said earlier, we are paying very close attention to what is happening on the ground with the virus, and following the advice of public health authorities in terms of making these decisions. So it's possible there could be further steps, again, to it's all about social distancing, and as you said, Tom, that's why Tom and I are sitting apart. So no plans right now, but it is possible that further actions could be taken by the state, going forward, again, depending on how the situation continues to evolve.
Nicole Masalam says other states have recently designated grocery store workers as emergency workers. Will Massachusetts do the same?
I don't know that there's been an official definition of essential workers. I may be wrong about that. But for example, in the case of the emergency childcare providers that I spoke about a moment ago, where the Department of Early Education is going to be licensing essentially emergency providers. It might be existing providers who stay open. It might also be some new facilities, let's say in a hospital. And they are going to be for essential workers. But right now, from talking to the Commissioner of Early Education yesterday, I was assured that would be, fairly flexible to cover different kinds of workers. So I think the state's trying to not be too rigid here, but to be reasonably flexible so that those people who really have to go to work, and clearly I think grocery store workers would be in that category, because otherwise, how are we going to keep supermarkets open, can continue to go to work, and if they need childcare, they'll be able to get it, or other support that they may need. I mean, we're definitely focused on making sure that our basic economy continues to function, and our basic essentials of life, continue to be there for all of us, to get through this together.
Anna Jeffrey said, Massachusetts and the Boston area have a lot of makers and maker spaces. How can individuals effectively offer their services to hospitals to supplement personal protective equipment and replacement parts for medical equipment in a way that's safe and meets the needs?
Yeah, that's a good question, and I really appreciate you thinking that way. This is really an unprecedented situation, and I think everyone's sort of stepping up to say, hey, how can I help? Could be as simple as checking in on your neighbor at a reasonable distance, of course, but make sure they're okay, particularly if they're elderly or have a disability. Supporting local nonprofits like food pantries. I mean, people are stepping up in all kinds of ways. In terms of PPE, personal protective equipment specifically, I did see actually yesterday a call going out to our healthcare and biotech companies to essentially marshal their resources to provide additional funding and equipment directly to the state's Department of Public Health, and then they would triage, making sure it's getting out to the hospitals and others that need it. So I know they're doing that. That's sort of an organized effort within the biotech industry. In terms of individuals, I think maybe we should follow up with you and maybe reach out to us, Anna, directly, and we can make some inquiries to see, what might be some ways we could connect, folks in with, probably within the Department of Public Health, and take it from there.
This is definitely a question I know you have the answer to. Palani Nataraja asks, is any unemployment insurance going to kick in while the people are at home?
So yes, absolutely. One of the most important things that we can do in this emergency is to make sure that anyone who has lost their job or has had to temporarily shut down their business or in any way has had their income interrupted can access unemployment insurance. That's what it's there for. It doesn't replace your entire salary, but it does partially replace it, and that's exactly why we have an unemployment insurance system. So what we've already done, I'd say three steps already. The state, through legislation we passed earlier this week, and Governor Baker signed, we've waived the normal 1 week waiting period to start collecting unemployment insurance. So as soon as you become unemployed, you can file online with the Department of Unemployment Assistance, DUA. If you have any problems with that, contact my office. But you can file as soon as it's determined that your loss of employment is due to the virus, the pandemic, and the state of emergency declared by the governor as a result of the pandemic. You can qualify for unemployment and you can start receiving it right away. Second step that we took is to waive some of the rules around unemployment insurance, for example, job search rules. So this would be very streamlined and folks wouldn't have to worry about that. And then third step is what the federal government just did through the legislation that Congress passed, Senate passed it yesterday. President Trump just signed it, which is providing very substantial additional funding for our unemployment insurance fund, for each state's fund, so that we can shore up the unemployment insurance fund and make sure that we have the resources to pay all the unemployment insurance benefits.
Great. We've got a few questions here, so I'll kind of summarize the spirit of them on a topic that I know is near and dear to your heart through your work. A lot of folks are pointing out, obviously last fall, the legislature passed and the governor signed the Student Opportunity Act, which would be a dramatic overhaul and increase in school funding from the state. A lot of folks are asking, in so many words, is there a chance that the Student Opportunity Act's implementation is going to be delayed because of the need for budget resources to go towards COVID-19 relief? Does this mean anything for school funding over the next couple of years?
So the short answer to this question, and really any question related to the state budget and funding for all kinds of important state programs, whether that's healthcare, transportation, environment, and so on. The short answer is, unfortunately, right now we just don't know. The reason is we don't know yet what impact the outbreak and the pandemic is going to have on the economy first, and then on tax revenues that come into the state. Obviously, we rely heavily on income taxes and both personal and corporate, as well as sales taxes and gas tax. So all of these are likely to be impacted, unfortunately, negatively by the pandemic. But we don't yet know exactly what the extent will be and how much it'll be impacted. It really depends on how long this all lasts and how effective we are in the measures that we take, the social distancing measures, the economic stimulus measures that the states, federal and state governments are taking. All of these things are going to have an impact. So we have to wait and see. The governor did put out his proposed budget back in January for fiscal year 21. The House of Representatives is supposed to debate and pass their version of the state budget in April, but we now looks like that may be pushed back. The state Senate is supposed to do the budget in May, but again, we don't know exactly whether we'll be able to do it. One of the challenges is, first of all, the uncertainty around state revenue, but the other challenge is even just getting together to do our work. Because most of our work is being done remotely right now, but we can't really vote on legislation remotely. Something like the budget, we can't take. There are actually some pieces of legislation, like what I already described, that we are able to get done still, but something like the budget would be very difficult to do if we're not in person. So we have to figure all that out. I am meeting with the chair of the Ways and Means Committee, which is the Budget Committee, on Wednesday next week. And this is one of the main topics I'm planning to talk to him about, is his projections for the budget and what that means for education spending specifically. Let me say in conclusion, I will do everything I can to try to continue to the implementation of the Student Opportunity Act. It is very, very important that we do deliver the funding to our school districts that was promised by the Student Opportunity Act. Our districts, it's critical funding that they need. And so I think we're going to certainly do, it will be, I know, a top priority for the legislature, and we'll do everything we can to still deliver that funding as much as we can.
Great. We've got a couple questions here, so again, I'll kind of summarize. Both folks asking about whether there are considerations going on for any rent or mortgage payment moratoriums, but also from the landlords and real estate perspective, asking you and your colleagues to consider what the impact of something like a rent moratorium would be on people who do own rental properties. So could you speak a little bit to kind of some of those different questions around housing security?
Sure. So I think the bottom line is we want to make sure that folks have safe housing and whoops, we lost our lights. That everyone has, is safely housed, has access to, obviously, to food and, the other essentials of life. I mean, those are the most basic things. So what I think the main goal here in terms of housing right now is to make sure we do everything we can to prevent, evictions or foreclosures. So that's really, I think, what we're focused on. What actions do we need to take to try to make sure that doesn't happen? Already, our housing courts are essentially shut down, for non-emergency matters. So they're effectively not processing, evictions or foreclosures that might ordinarily go through the housing court. So they would be stayed. But we are definitely aware of this concern. We absolutely want to make sure that nobody's going to be losing their apartment or their home in the midst of a crisis. And so if it's necessary, I think to actually pass legislation to take some steps here to prevent evictions or foreclosures, I think we will be looking to do that. I don't know that we would be going beyond that to give further relief from rent or mortgage payments. But I think our goal in terms of helping people is more through things like unemployment insurance, and the federal government is talking about just sending direct payments directly to all Americans, and the idea there would be to help cover all costs, whether that's housing costs or food or utilities or other costs of daily living.
Thanks. Related question from Bob Bell, also speaks to real estate. He says, the real estate community is concerned that this important engine of our financial health is threatened by the medical crisis, risking financial crisis as well. It's economically critical that businesses which can be safely conducted continue. A proposal was delivered to Governor Baker today to allow for virtual notarizations by quarantine buyers and sellers with proper safeguards to comply with consumer protection laws. He says, please support this united proposal of Mass Association of Realtors, Greater Boston Real Estate Board, Mass Mortgage Association, and others.
Great, thank you, Bob. I've been following your feedback to us about the registries of deeds and concerns about that, and the importance of those organizations to the functioning of our economy and real estate transactions. So that's a great proposal, I think. I would strongly support that. I think moving to more electronic notarization in general for many different transactions, is a good idea and helps to speed up transactions. It's easier and more convenient for everyone. So I think that sounds like a really good idea. I'm glad you brought that up.
Great. And then one more real estate related question that I think segues well into some other issues. Paul Weston says real estate agents are considered contractors along with many other professions. What help is there available for contractors overall who are ineligible for unemployment benefits?
Really, really important question. this is one I'm particularly concerned about because prior to being the chair of the Education Committee, which is my current role, last session I was actually the Senate chair of the Labor and Workforce Development Committee, and really helped me understand better the extent of the essentially independent contractor or gig economy. And that's always been there, but it's been growing substantially over the last decade. And there are so many folks right now who don't fit into a traditional employer-employee system where they have healthcare benefits, retirement benefits, workers' compensation, unemployment insurance. And this is, when we run into a crisis like this, it really puts a spotlight on that there's no lack of a social safety net for those folks. So we have to figure something out here. I don't know exactly what the answer will be, but I can assure you again, we have escalated this issue within the Senate's Emergency Task Force. We've been talking about it. Senate President is well aware of it. I know the governor is. So what exactly that solution will be, I can't tell you yet, but we're certainly aware that unemployment insurance is great, but it doesn't help everybody. Let me sort of say as a side note, out of the Great Depression in the 1930s kind of came the New Deal. And sometimes out of crisis, we are able to come together as a community, as a state, as a nation, and really learn from these crises, and how do we strengthen our social systems, our economic systems, our political systems. And so right now we're focused on the crisis and getting through it day to day, even hour to hour. But once this is all behind us, I, for one, certainly hope that we are going to look at what we can learn from this, and how do we really ensure we have a public health system that is ready for whatever the next public health crisis might be, and that we have the social and economic structures in place and the social safety nets to make sure that we can weather any storm going forward, and that everybody has that, at least that minimum level of economic support no matter what.
Michelle Bergstrom asks, what's the plan for MCAS testing?
Thank you, Michelle, and thank you also for your service on the school committee. I really appreciate everything that our local town and city officials are doing right now under extraordinary circumstances. Our school committee members, our city councils and select board members and planning boards, and of course our local public health are doing an amazing job. So thank you so much. I know how difficult this is. In terms of some of the requirements on our schools, we totally understand that it is unreasonable to continue to expect our school districts and our students to meet those requirements when they're shut down, and could be shut down for quite a number of weeks. So I do expect that we will be taking action to waive MCAS requirements for probably for the rest of this school year. I believe a few other states have already done that. We do need some federal action to give a waiver under the Every Student Succeeds Act. I think that's expected if it hasn't happened already. And then it would require state legislative action as well, and we are already preparing to do that. Another step that we will be taking is the Student Opportunity Act has an April 1st deadline for submitting districts' school improvement plans, and we are almost certainly going to move that date back. So it'll either be moved back probably to May 1st or perhaps even later. So we will take action on that. We will take action on MCAS. I'm very confident of that. And I suspect there'll be a number of other areas where we've been talking to our superintendents across the state, and our school committee members, and our school business officers, and getting feedback from them on what other steps we need to take to help them get through this crisis. So stay tuned on that, but I think you'll see action coming soon in the next week or so.
Great. We've got a couple great questions from Inna Babitskaya. She says SNAP recipients should have a possibility to purchase food online by using their cards. She also says for Social Security and Social Security disability recipients, the income asset limit that's allowed on their checking account should be increased so that their benefits wouldn't be decreased or lost due to the excessive amount on their account. So a couple good questions. questions about.
Thank you. Those are really great points, and I think we need to take that back and talk to some folks about that and share those thoughts with some of our colleagues in the emergency working group. I don't exactly know in terms of SNAP benefits and EBT cards, how that works today in terms of trying to use it online. But thank you for sharing that, and we will take that back and discuss it further.
Here's a really important question. If somebody feels crummy but not critically ill, what do they do next? Who do they contact about possible testing for COVID?
Yes, thank you for asking that question. What we don't want people to do is go to the emergency room. Please don't do that. I mean, obviously, unless you're having an emergency and you would ordinarily dial 911. But if you're just not feeling well, stay at home, of course. If you can, separate yourself from the rest of your household and monitor your symptoms. I think most people know at this point what the symptoms are that generally are associated with COVID-19. Very, very often usually a fever, right, over 100. Often a coughing, and what else?
And a shortness
of breath. Yes, in some cases, shortness of breath. That's right. So, there are still, obviously, the regular seasonal flu is continuing to go around. Obviously, colds. So all of those are circulating just like they ordinarily would. So monitor your symptoms. Talk to your primary care provider. One of the other steps we took, by the way, in our state government is we've expanded the use of telehealth, and I'm very pleased to see this. I actually have legislation that I have filed that would have done this, that was seeking to increase the use of telehealth, and we've seen through this crisis how useful and helpful telehealth is, where you can basically communicate with your healthcare provider, over a phone or video conference. And what this legislation does, and the action that the governor took recently, makes sure that it is services delivered this way are covered by insurance, so that there's essentially parity for the healthcare provider in terms of in-person versus telehealth. Anyway, so that's one of the ways you can increasingly communicate, but you should be reaching out to your primary care provider, following their advice. And if they believe that you're somebody who should be tested, given again your symptoms, then you would then seek a test, and your doctor, your primary care provider, would tell you where to go next to get a test. We are standing up more locations for testing around the state, so again, that will become easier. You've probably seen some of these drive-through testing locations that have been popping up in other states, and we're going to have some of those in Massachusetts as well.
Catherine Boyle says Mass Health is now covering 90-day prescriptions, but it doesn't override the 30-day limit on controlled substances. This is a problem for people with prescriptions for ADHD meds.
Okay.
Can you help advocate on this issue?
Thank you, Kathy. Very good feedback on that. So we will take that point, and we'll get that today into our Senate task force where we can escalate issues. Thank you.
Alicia Toledo asks, will employers still have to go onto the unemployment insurance account to approve the employees who filed, or will it be automatic? I don't know if we know that one.
Not sure the answer to that one. Yes, ordinarily there is a waiting time, right, because the employer has to approve it, and that's part of the reason for that waiting period. So I think it's being expedited so that, again, folks can get access. So I think it is. There may be still sort of a process after the fact for the employer to confirm that the individual, was
right. They'd still need to confirm.
Probably need to confirm that
the person was an employee.
That's right. They were an employee, and that they, were laid off or furloughed or lost their job. So, but we'll confirm that, and we can put that answer into the comments for you. But thanks for asking that.
Carol Savage had a couple questions. First, as a follow-up to the MCAS question, she asked, do you think it's likely that students might have the MCAS graduation requirement waived this year if MCAS is going to be delayed?
So thank you, Carol. Yeah, we are looking at all aspects of MCAS testing and the overall state's accountability system. So that would include testing, obviously, for grade 3 all the way up to grade 10. And seems, as I said before, very likely that will be waived for this school year. And then there is also, of course, the graduation requirement, as you rightly point out, that 10th graders take, and if they don't pass it in 10th grade, they retake it in 11th and, if necessary, 12th grade. So that's also on the table, and we are, again, discussing, what the best way is to handle that issue as well. And again, I can't say for sure right now, but again, it seems, obviously very difficult and unfair to try to ask students to still be able to take and pass that as a graduation requirement when schools are closed, and they're not getting the support and education that they would need.
Carol's other question has to do with communication of a lot of this information and guidance that we're sharing. She says people who don't have internet access may not be as up to date on the latest information. What are the other ways we're disseminating info? Robocalls, helplines, anything like that?
So it's, there's a lot going out through, traditional broadcast media, radio, still newspapers. And, most people obviously are getting this information now online. Our towns are also doing a great job in getting information out. And I think there have been some, reverse 911 calls. Are they? Yep. Is that the right name?
Yep.
Reverse 911, yep. Right? Where the calls with urgent information are sent out to members of the community. So I think that's being used as well. But I think the important thing is probably, this is exactly where you were going with your question, is just making sure we're getting good, trusted, accurate information out to everybody, as quickly as we can. I mean, it is very fast moving, things are changing, but I think it's really important that information get out. So again, that's why I want to urge certainly everyone who is online and has access, check your town or city website. They are keeping them updated with the latest information for the local community. Check the mass.gov/COVID-19 site. That is the central repository for information for the state, health information, and all of the steps that we're taking to support our communities, our businesses, our workers, and so on. And then, of course, at the federal level, the CDC.
And I would also just add, if you know that you have maybe an elderly family member or neighbor who doesn't spend a lot of time on the internet and you're concerned that they might not be reading the same information you are, it's really important for all of us to call people who we think might be a little bit out of the loop, get in touch with them, share information with them about what they need to do to stay safe during this time. So it's also really important, just a matter of sometimes picking up the phone and calling your next door neighbor to see how they're doing as well.
Great point, Tom. Yep, we all got to look out for each other at this time. Yep.
Michelle Bergstrom also asked, what assistance is the state providing for social services such as foster care to ensure we have safe visits by care workers?
So we are, there is essentially a war room of sorts, if you will, that has been set up within the state government, and that is being led by Mary Lou Sutters, who is, in her day job, is the Secretary of Health and Human Services for the Commonwealth. She's phenomenally competent, and so she's kind of leading the charge, again, and coordinating closely with all state agencies and the legislature, and they are working, thoroughly department by department, agency by agency, whether that's Department of Mental Health, the Department of Education, Elder Affairs, etc., to make sure that whatever the issues are that are arising, in this case it would be DCF, Department of Children and Families, whatever the issues that are arising in their area, we understand those, we triage them, and we say, how do we make sure we can observe the needs from a public health perspective, and at the same time make sure we keep our children and families and elders safe.
A couple questions here that are all kind of on the same topic when it comes to capacity and supplies for our healthcare system. Are there plans in place to address a potential shortage of beds in our hospitals? what kind of work is going on to make sure, I know you spoke to this a little bit earlier, but what kind of plans are in place to make sure that our healthcare workers have the supplies they need, especially that personal protective equipment that we've talked about a few times. Can you speak a little bit to that?
Sure. So this is an absolute top priority for us, in our communities and in our state, and I would say around the country. Job one here is to make sure that we are containing the virus as much as possible. And for those folks who do get sick and do require hospitalization, as you know, most people who get sick don't have very severe symptoms, but those who do and require hospitalization, that there are beds available, that they will get the treatment and that they need, and that the hospital workers and first responders have the protective gear that they need so that they can help those patients. So there have been a lot of steps that have been taken over the last couple of weeks to prepare. We're fortunate to have some of the best healthcare providers, in the world. They have been taking a lot of steps to increase capacity in the number of beds. They've been, for example, they have been canceling or rescheduling lots of elective surgeries. They have been, standing up some additional capacity wherever possible. So they are taking steps. We nevertheless are concerned, again, depending on how bad this is and how fast this ramps up, to have the bed capacity. Again, as everybody's probably already well aware of the idea of flattening the curve. The more we practice social distancing, the more we slow down the spread of the virus. That is exactly what we need to make sure we don't have a huge spike in the number of our neighbors who fall seriously ill and have to be hospitalized. So that's why we really need to do that. But again, our hospitals are trying the best to prepare. They are worried, I'll be honest, in terms of making sure they do have the capacity. And in terms of the personal protective equipment, again, we spoke about that earlier in this town hall. It is a very high priority to get enough masks and gloves, gowns, goggles, other equipment that's needed for both our nurses and our healthcare workers as well as our first responders. And there are major efforts underway, not just in our state, but around the country to activate more production and to get more of that equipment into the hands of those who need it. It's being kind of managed through the Department of Public Health and our emergency command structure. Any requests that come in or ideas, again, should be sent our way here. And for example, if you're aware of a facility, let's say a nursing home or a local hospital that has a severe shortage, we want to know about that and try to make sure that can be addressed.
Here's a really important and kind of a tricky question from Susan Needleman. She said, if someone gets the virus and has someone at high risk in their house, is there a place that the sick person can go? And she followed up by saying, if you get sick, can you still go to the hospital if you want? What's the process there, especially if you've got a high-risk person in your household?
Yeah, that's certainly a tough and scary situation. Again, I'm not a medical provider myself, and I'm obviously not a public health expert, so I want to be cautious in providing advice. What we've been told by public health experts is, first thing to do, of course, is separate yourself as much as possible within your own home from the rest of the household. And of course, that would be particularly true if you have another household member who might be more vulnerable to this disease. So separate yourself, monitor your symptoms, and again, call your doctor, your primary care provider, and then follow his or her advice as to whether you should then be tested, or if necessary, go to the hospital.
Great. And here's a pretty simple question, and I think part of the answer is that it started a little bit already, but when is the drive-through testing going to start?
It is up and running in some places around the country. You've probably seen that already. I'm not 100% sure if it's up and running in Massachusetts.
We've got one or two locations in Massachusetts so far,
okay,
but they're small so far.
So still small, but you're going to definitely see that ramping up in the days to come. And again, part of this is having the infrastructure to conduct the tests, having the people to do it, the swabs, but the real bottleneck has been actually the capacity to run the tests.
Right.
And until recently, we just had the state's public health lab, which is a fantastic lab, but they could only do so many tests every day. now they've doubled their capacity, and we've brought online a number of private labs that have been certified by the FDA to do the test. So that capacity has expanded a lot. In fact,
It's going to be going up to
it's
3,500.
right. So by Monday,
Yep.
we expect to be able to do 3,500 tests per day between the state public health lab and the private labs. And the priority for testing, will continue to be those who are presenting with the symptoms and are hospitalized, and then also our frontline health workers and first responders.
And I think something that's really important to note when it comes to testing is that right now testing is prescription only. You can only do it if your doctor's asked you to get tested, and that's a really important part of making sure that there are enough tests available for the people who are most likely to have the illness. So that is one really important element. Even if you know that there's a drive-through location near you, you can't just show up and ask for a test. You do need to have your doctor recommend it.
Exactly. Good point.
Let's see. So one question here from Karen Caputo. Are there any plans to utilize alternative facilities such as conference centers or hotels as alternative medical treatment or recovery centers? And similarly, Inna had asked earlier about the possibility specifically of using some of the space at the old Malden Hospital for some extra medical space.
Yeah. Yes. Very good. Very good point. This is being discussed. Extra capacity potentially for patients, for those who are presenting with symptoms, also for healthcare workers, because there are some nurses and other healthcare workers that would rather not be going home because just in case they did get the virus, they don't want to put their family at risk. So they might prefer to have temporary emergency housing. So yes, all of that is being looked at. Some of the local colleges and universities are stepping up because the students have gone home, so the dorms are potentially open and available. And I guess the same would be true for many of our hotels right now. So yes, I really appreciate that a lot of them are stepping up and saying, hey, we want to make our facilities available for, again, to the extent that that's needed. And the state is actively working with them, again, led by our Department of Public Health to try to stand that up.
Ed Andrews said, where are we with the tea schedule? Switching to a Saturday schedule has made social distancing on parts of the tea much more difficult.
Yes, I understand this concern. I think that right now the number of folks that are actually riding public transportation has gone down a lot more than the MBTA has cut back the schedule. So, I think it's still, possible to use public transportation if you have to, and keep your distance from the other riders, commuters. And that obviously is the goal. What will happen going forward with public transportation? I think for sure we will need to maintain public transportation for our essential workers, because obviously many of them rely on it to get to and from their jobs. So I think that will continue, but whether there'll be additional reductions in the schedule, can't say for sure, but we'll have to we'll have to see how the situation continues to evolve.
And I do know that after the first day of schedule reductions earlier this week, the T did add back in some service on the Blue Line for the morning commute because they found the Blue Line trains were very crowded, and on parts of the Green Line and a couple bus lines for the evening commute because again they found that those particular routes were more crowded than public health officials recommended. So certainly there's no doubt that there's always room for improvement, but I do think that the level of crowding on trains and buses is something that the MBTA is trying to keep track of.
Yeah. And we definitely need to be, concerned about that, because obviously you can't, if we can't achieve the right distances, social distancing, then we need to going to need to take further steps.
Sue asks, has the governor spoken with the National Guard to perhaps consider setting up tents and take over fields near hospitals? The military can do this easily and they're used to doing it.
We're well aware, again, another great question. We're well aware of the importance of the National Guard and the role that they, can play in an emergency. And so that is definitely one of the tools in the state's arsenal, if needed, to have National Guard help with distributing supplies. We talked about standing up temporary facilities for patients, for frontline workers, other ways to help with all the tasks that have to get done. So that's definitely I don't think any decision's been made on that, but that's certainly a possibility.
Carol O'Loughlin asks, how are people without a healthcare plan or a PCP supposed to get an order for testing?
So we would hope that, given that Massachusetts, has the highest rate of insurance, health insurance of any state in the country, the vast majority of people, should have, access to care, should have a plan, whether that's through Mass Health, which is our Medicaid program, or through, private insurance. But if somebody doesn't, tests are being provided for free, and any treatment related to testing, any procedures related to testing or treatment for COVID-19, the co-pays or deductibles or any out-of-pocket costs have already been waived. So that step was taken already about a week ago. So because we want to make sure anybody who needs to be tested and anyone obviously who needs treatment gets can get what they need. What they would do, I think, in that case is what they would do in ordinary circumstances when they need to see a doctor if they're feeling sick. Whether they would go to an urgent care clinic or wherever else, community health center, for example, would be another place that people would go. So I think they would still use those resources, in order to get checked out and also if a test is necessary.
And the other thing I know is that the Mass Health Connector opened up enrollment again for folks who might be uninsured.
Right, that's a great point, because usually there's a window each year when you can enroll in health plans through the Connector, and they opened that up. So you could just check that out. You can find it online if you need to, or contact us and we will give you the information.
Well, the questions seem to be waning now, and it's just 5 o'clock, so I don't know, Senator, if you have any last thoughts before we wrap up.
Well, thank you, everybody. Again, really appreciate great feedback for us. I know we have a number of action items to follow up on. Great questions. Hopefully this was helpful information. Again, please continue to just rely on trusted source of information and not rumors that might be flying around social media. Stick together. We will get through this. Reach out to your neighbors, and if there are further questions that come up, feel free to just, again, reach out to us through phone, email, social media, and we'll also see if it would be helpful to do another one of these Facebook Live events, early next week. We're also sharing a lot of information on our social media page, Facebook and Twitter, regularly. We're also we'll be sending a regular email newsletter with updates and access to resources. So, sign up for that if you haven't already. And thank you everyone, and stay safe, and best wishes to you and your loved ones.